My name is Eric Gross, and yesterday I had meniscus repair surgery on my right knee. And the reason I'm doing this very short video is simply to um, talk about my own experience and sort of inform you of what you can expect on your first day after meniscus surgery. And I don't know, but if you're like me, I mean, some of the biggest concerns we have for going into any surgery is how uncomfortable are we going to be immediately after the surgery? Because we know that on the day of surgery, we're fully anesthetized and we have medicines are given to us to make sure that we generally don't feel the full impact pain-wise of the surgery on our first day. It typically kicks in the next day. So this is the next day. So I had surgery yesterday morning in New York City. New York City is a place where you do a lot of walking. There's a lot of steps. So it's very demanding on our legs and our knees. And surgery was performed about 8 in the morning, and it's about 11 in the morning on the next day. I just want to say that the only pain relief I've taken is 2 ibuprofen this morning, and I can walk around quite well. I can walk steps. When I'm in a seated position, I have absolutely no pain at all. Walking around, I got to walk carefully. There's maybe a number 2 level pain when I walk, but it's quite manageable. I believe I could even go shopping if someone else is driving, or if in New York, I'm just walking a very short distance. You got to be careful. I think steps are a little bit more difficult, but I'm not using crutches, not even close, and I'm not using a cane. So I'm just saying that the only thing I've done is I've iced my knee. I did a fair amount of that, and the only pain relief I've taken is 2 ibuprofen this morning. Now, yesterday, I did have a bad response to the anesthesia, and I was also given oxycodone and Dilaudid for pain management. I did experience a fairly high level of pain in the recovery room. For that, they gave me the Dilaudid and the oxycodone, which greatly reduced the pain. But I am a migraine sufferer, and I got a very bad migraine after the anesthesia, and made me quite nauseous, woozy. I was quite uncomfortable on the day of surgery. But all that is gone now. I did medicate for the migraine using sumatriptan. I think you can use any triptan if you're a migrainer and get good results. Not perfect results, but the first day is kind of a chaotic kind of day physically. So I can tell you on the second day, I can get around just fine. I've walked around this building. I've walked steps. I have helped prepare breakfast, and I'm in a seated position. I have 0 pain. So anyway, please feel free to make, if you have any questions or comments. I am also an elderly patient. I think a younger patient would do even better. I think I know what caused my meniscus tear. It's hard to tell exactly what, because as you age, your meniscus becomes more prone to simply wear and tear. It doesn't have to be much to cause a damage to it. And then another thing I did research was physical therapy as an alternative to surgery. And that is a reasonable alternative depending upon the nature of your tear. There are certain tears that are not amenable to physical therapy and will not be cured by physical therapy. And if anything, they will be made worse by physical therapy. Those require, if you want to stop the pain and the lack of mobility, those will require a surgical intervention. So anyway, thank you for watching. Again, feel free to submit your questions or comments, and I'm here to answer them. Okay, bye-bye.